This is Peter. He has something in common with more than 1.2 million people in Europe. They all have Parkinson's disease. Tremors, rigidity, and dyskinesia get in the way of everyday life. Simple activities become almost impossible for him. This is Emily. She has Parkinson's too. There have been times when her symptoms have improved, but they always come back, even when her medication was increased. One day, her neurologist told her there was another treatment: deep brain stimulation, or DBS. DBS therapy has changed Emily's life for the better. DBS is like a pacemaker for the brain instead of the heart. Electrical stimulation is sent directly to the brain through thin, soft leads implanted in a precise area of your brain. This improves the brain circuits which control movement. Peter isn't sure about having surgery, so Emily explains what it was like for her. After her discussion with a neurologist, Emily was referred to a DBS center. DBS therapy is a routine procedure and the risks are well understood. The center did some tests to see if DBS therapy was likely to help Emily. Before the surgery, Emily had to have an MRI scan. The MRI image helps the neurosurgeon to plan and place the leads in exactly the right place. In the operating room, Emily had to wear a head frame. The head frame is used to place the leads precisely and can seem a little scary at first. Emily was soon made to feel comfortable though. Next came some tests to check whether the DBS therapy was having an effect. Emily was awake and felt fine. She was asked to perform some tasks, like to hold her hand as still as possible and to open and close her hand as fast as possible. To her surprise, she was able to perform these actions with ease for the first time in years. After this, Emily was put under general anesthetic so the neurostimulator, which controls the electric signals to the brain, could be implanted in her upper collarbone. After the operation, it took several weeks to adjust the stimulator and medication in order to achieve the best possible effect. When complications do occur in DBS, they're generally mild, short-lived, and normally resolved around 30 to 90 days after surgery. 99% of serious adverse effects are resolved at 6 months. Emily has been able to get back to her normal daily life, and she feels more like herself. She's loving being active and socializing. She's now one of more than 125,000 people worldwide treated with Medtronic DBS. Emily suggests to Peter that he should discuss DBS therapy with his neurologist, and to learn more about the benefits, risks, and safety information,